My name is Jane Reusch. I'm a professor of medicine at the University of Colorado in the Rocky Mountain Regional VA.
I'm Michael Lincoff. I'm an interventional cardiologist and clinical trialist at the Cleveland Clinic and a professor of medicine at the Case Western Reserve School of Medicine.
The fraught nature of previous interventions to decrease obesity and that magic number of 10 to 15% weight loss. Can you tell us a little bit more about why that number might be magical?
We have no pharmacotherapy that's accomplished that in a routine fashion, aside from GLP-1 receptor agonists or dual agonists, some of the newer ones being developed like tirzepatide. Those are the drugs that in the diabetic patients, in the patients with diabetes, have demonstrated the cardiovascular benefit. Whether or not there's a specific reason why that threshold has a physiologic basis, I think that's part of it, but I don't think we should over-focus on magnitude of weight loss, because I think specific mechanism of drug is very important. We've seen that with the treatment of diabetes. There are many classes of agents that influence glucose metabolism, that influence insulin sensitivity, and the magnitude of their effects may vary somewhat. GLP-1 receptor agonists are fairly potent, but they're not in a class by themselves in terms of the changes in A1C that you see with therapy. And yet they're the only class that reduce ischemic events. Now, SGLT2 inhibitors clearly do have cardiovascular effects as well. Whether or not it's through the ischemic mechanism, the atherosclerotic mechanism is something that can be debated. But mechanism of action, I think, is as important, if not more important, than the magnitude of weight loss. Just as in the setting of diabetes, mechanism of action rather than glucose reduction is very important.
Yeah, I would like to sort of take it that one of the things about this magic number of 10 to 15% is that it goes hand in hand with specific kind of reversal of the pathophysiology by which diabetes and obesity are accelerating cardiovascular risk. That's really exciting and interesting from a perspective of it is clear and there is some moderation effect of glucose per se on improving cardiovascular risk in people with diabetes in response to a GLP-1, but it's not the whole story. And so when we come to direct effects of GLP-1 receptor agonists on the heart, the vasculature, the brain itself in terms of brain health, and the whole integrated physiology, that is the place where I think that we're looking to these newer agents that are sort of almost restoring normal physiology